Hey everyone, welcome back to Corporate Decoder, the place where we make sense of the corporate jungle like a seasoned explorer, not a lost tourist. Today we're diving into a report from BioXcel Therapeutics, and let me tell you, their latest announcement might just be a game changer, or maybe just another day at the office for this company. Stick around to find out if this is a breakthrough or a breakthrough in the making. And before we get lost in the scientific jargon, don't forget to smash that like button and subscribe for more decoding action. Want to join a community of fellow corporate sleuths? Well, our Discord is linked in the description below. Alright, so what's the big news from BioXcel Therapeutics? It looks like they've reached a crucial milestone in their clinical trials. They've announced the last patient, last visit for their Serenity at Home pivotal phase 3 safety trial. Now that sounds like a mouthful, but what it really means is that they finished gathering all the patient data for a big important study. This report is dated August 1, 2025, and it's all about this trial focusing on the acute treatment of agitation. Think of it as trying to calm people down quickly when they're agitated due to bipolar disorders or schizophrenia. The drug they're testing is called BioXcel 500, and they're looking at a specific dose of 120 micrograms. This trial is designed to be super thorough. It's double blind, which means neither the patients nor the doctors know who's getting the actual drug and who's getting a placebo, a fake treatment. This helps ensure the results are as unbiased as possible. BioXcel Therapeutics is traded on the Nasdaq under the ticker symbol BTAI. So if you're an investor, this is definitely something you want to keep an eye on. They have common stock trading on the exchange. This report is filed with the US Securities and Exchange Commission, or SEC as it's more commonly known. They're the government body that makes sure companies are transparent with their investors. Now, this next part is a bit of a formality, but essential for companies that are just starting out in the financial world. It's about how they handle new accounting rules. BioXcel is indicating they are not an emerging growth company and they haven't opted out of any transition periods for new accounting standards. This implies they are following the standard timelines for adopting new financial reporting practices. The real meat of this report falls under item 8.01, other events. This is where companies announce significant happenings that aren't necessarily covered by other standard report sections. So back to the trial. The Serenity at Home trial sounds pretty impressive. It enrolled over 200 patients across 22 different locations nationwide. That's quite a spread. And to ensure fairness and avoid over-reliance on any single location they made, sure no single site had more than 11% of the total patient population. That's smart. They're spreading their bets, so to speak. The patients were also split evenly between those with bipolar disorders and those with schizophrenia. And get this, the vast majority of patients who took the drug actually finished the full 12-week study. This is a really good sign. It suggests that the treatment is either well tolerated or the patients are seeing enough potential benefit to stick with it. When people stick with a study, it generally means the drug is safe and potentially effective enough for them to continue. They collected data on over 2,200 episodes of agitation. That's a massive amount of data from this single trial. And the most exciting part, the top-line results, meaning the initial key findings, are expected to be announced this very month. This is what everyone's waiting for. Top-line results can give us the first real glimpse into whether this drug actually works and is safe for wider use. Now, every company report comes with a disclaimer of sorts about forward-looking statements. Basically, they're telling you that a lot of what they're saying today is about the future, and that future things might not happen exactly as they expect. They're specifically mentioning that statements about their upcoming data release and their submission for a new drug application to the FDA, which they call an SNDA, are forward-looking. This is standard practice to protect themselves if things don't go as planned. They use words like anticipate, believe, expect, and plan to signal these future-oriented statements. They are saying they have good reasons for their expectations, but they also admit that the future is uncertain. They're being upfront that actual results could be very different from what they predict. They point to their risk factors section in other filings for more details on what could go wrong. It's a very standard way for companies to communicate future possibilities while managing expectations and legal risks. Finally, the report is signed off by Richard Steinhardt, the Chief Financial Officer. His signature on August 1, 2025 confirms that the company is officially submitting this information. Now let's put on our investor hats. What does this all mean for BioXcel Therapeutics? They're making a big bet on BioXcel 501 for agitation. If these top-line results are positive, especially around safety and efficacy, that could be a huge win. The market for treatments for agitation in bipolar disorder and schizophrenia is significant. A successful drug here could mean substantial revenue for the company. However, we need to remember that clinical trials are complex, and even a seeming success at the top line can run into issues later in the regulatory process or during post-market surveillance. The fact that most patients completed the study is encouraging as it suggests tolerability, but the real test will be in the detailed data when it's released. BioXcel Therapeutics is in a highly competitive and often volatile industry, biotechnology. Success hinges on the delicate balance of scientific innovation, rigorous testing, and successful navigation of regulatory hurdles. Their strategy here seems to be focusing on unmet needs in psychiatric care, a smart move if they can deliver. The key risks for BioXcel at this stage would be negative trial results or manufacturing challenges or even competition from other companies developing similar treatments. They've managed to get a good number of patients into this trial, which shows they can execute on the operational side of clinical development. In conclusion, BioXcel Therapeutics seems to be on the cusp of potentially significant news. The completion of their Phase 3 trial is a critical step. We'll be watching very closely for those top-line results in the coming weeks. If they are favourable, expect a lot of buzz around BTAI. If not, the company will need to regroup and reevaluate its strategy. For now, it's a period of high anticipation. Alright, that's our decode of BioXcel Therapeutics' latest filing. What's your take on their trial progress, and what do you think these results might mean for the company's future? Let us know in the comments below. If you found this breakdown helpful, do give us a thumbs up and subscribe for more in-depth corporate analysis. And remember to join our growing community on Discord. The link is in the description. Thanks for watching, and we'll catch you in the next decoding session.